Okay, Psych 250 students, last time we were just about ready to talk about panic disorder. A panic disorder is kind of like an unwelcome neighbor or relative who just shows up. You're not expecting them, and all of a sudden, bam! It's like you just ran up 4 flights of steps. Your heart's racing, you can't breathe, you feel like you're about to die. You want to escape from your environment. Now, if a charging rhinoceros is running right towards you, you might have the same reactions as a panic disorder. That's just logical. But this comes rather suddenly. And when you ask people, what's causing these panic attacks? Why are they having them? How did they get started? A lot of times they don't know. So we look at the etiology of things. People just often say, I don't know why they started. They started around this time of my life, and they just come and go, and I spend more time worrying about them which sometimes induces the panic attack, thinking it can happen in class or at work while I'm driving, etc. Now, we know that there are some contributing factors, right? Our environment plays a role. And when it comes to anxiety disorders, there are some genetic issues involved too. We can, along with depression, um, have some of that built into our DNA, so to speak. But the environment plays a role in many, many different things. So that leads me to my second case study. And the name of the second case study is called Highway Freakout, and it involves panic disorder. Now, this takes place at the same location as the previous case study in the previous video, and that's at Mecca, Multi-Ethnic Counseling Center Alliance, East Lansing, Michigan. That was part of the counseling center at Michigan State University. Again, it involves a 19-year-old Caucasian female, and she came in and filled out the forms and said that she was suffering from panic attacks. That's pretty common in college life, university life. People get stressed out about exams, expectations. I get stressed out even before the beginning of every semester, hoping that I got everything ready and then we have a successful semester. I love it when my classes have 100% starting and finishing with a wonderful passing grade. It doesn't happen all the time, but I wish it did. So she comes in and she said it's summertime, and she said she recently had a panic attack. And so I asked her to describe it, and she, as if she was reading the DSM, she described it textbook. She had all the symptoms. And I said, have you had these before? Yes. Do you remember the first attack? And she said, yes. What happened was she was driving along the freeway. It happened to be one of those really super hot days. You know, one of those days where it's like 100 degrees and there's plenty of humidity. And suddenly her car, something goes wrong with her car. I don't know if it overheated or just stopped working. But she remembers driving on the freeway and seeing all the red lights pop up on her dashboard and thinking, oh my goodness, I'm in trouble because nothing's working. Even the power steering was messed up. And if you ever had to steer a car that doesn't have power steering, it's very difficult. So she's got no power, air conditioning's off, windows are up, and she's trying to get that car over to the side of the road. She just manages to do so, and she doesn't know what to do. Right? This is before everybody and their infants had cell phones. So she's sitting in the car pondering, oh my gosh, what to do? This car is broken on the side of the freeway. I have no way to get help. Well, a car almost immediately pulls over and a man starts walking to her car. Now she's nervous because she sees him. And she just keeps her face and her hands on the wheel looking straight ahead. He knocks on the window to get her attention because obviously she's not looking at him. And he asks her, do you need some help? She doesn't roll down the window or anything. And she says, no. And he's like, are you sure? Yes. So he leaves. She doesn't remember exactly how long she waited in that hot car. But the next thing she remembers is finding herself on the side of the car, on the side of the freeway, on some grass, collapsed. She had had her first panic attack and was immobilized. Now, we talked about her panic attack, and I asked her, what do you think is triggering? Because sometimes there's some factors that are actually triggering a panic. She had no clue. The more we discussed it with her most recent attack and her very first attack, which happened the previous summer, we discovered there were two variables involved that would set off her panic attack. One was intense heat. In both instances, it was extremely hot. Certainly in that car without any air conditioning, 100 degrees, high humidity, it was extremely hot. It doesn't take too long to sit in a car with the windows up and no air conditioning to get hot. Second condition was enclosed places. She felt trapped in that car. So if it's a hot day and she enters an elevator and the elevator starts acting kind of weird and doesn't want to open the door, she's probably going to have a panic attack. So we worked on some stress relaxation exercises. We recognized the triggers. So if she's got those triggers starting to happen, she can immediately practice her relaxation exercises and reduce or eliminate future panic attacks. No need for medication in this particular case. GAD, generalized anxiety disorder. Now, when I hear the word GAD, the first thing that comes to my mind is peanut butter. Because when I get my flour tortilla and put my peanut butter and jelly on it, how many of you like that besides me? Make that face. I think it's GAD because with GAD, you're feeling anxiety, but it's spread out like the peanut butter. You feel it at home, you feel it at school, you feel it at Costco, you feel it everywhere. And usually with this anxiety disorder, you're not sure what's causing it. The good news about anxiety disorders, we have very good success rate in treating anxiety disorders between things like systematic desensitization, meditation, sometimes medication. But the bad news is that people, again, don't want to deal with it because it makes them anxious just thinking about their anxiety. Okay, how many of you have a little bit of obsessive compulsive characteristics? I know I do, right? I've got all these ink pen collections, right? Why does he save these ink pens, that he runs out of ink and so forth? When does it become a disorder? Well, it becomes a disorder when your obsessions, those repetitive thoughts, and compulsions, those repetitive actions to counteract your obsessions, start to interfere with your life. Okay, so what's an example? Let's suppose that I have OCD, and every time I touch a foreign surface, oops, I touch my computer monitor, I have to leave the lecture and go wash my hands for at least 3 minutes. Now, during a pandemic, that's a good thing. But if on a day-to-day basis, every time I touch a surface, I have to run and wash my hands, that's going to be problematic. So in other words, the obsessions, the repetitive thoughts in my head says, if I don't wash my hands, something horrible is going to happen. I'm going to get some horrible disease. Bad luck's going to happen. I saw a video some years ago of a guy who washed his hands nearly an hour a day while at work. And in a typical 8-hour day, he spent an hour in the bathroom washing his hands. He had to wear gloves because his hands were so chafed and bloody and sometimes because he was rubbing them constantly. The same man had an urge to yell out profanities in a church mass. Not the time you want to yell out profanities. Excuse me. This same man had these thoughts of plunging a knife into his therapist's chest. Now, he didn't act out on that last one, but he told the therapist, and he was asked, well, how does your therapist react when you said, I have this urge to plunge a knife into your chest? The therapist just shrugged it off and said, it's part of your illness. We can work with this. So if you find yourself going back to check to see if you turned off that stove, that's normal. But if you have to check on it 10 times, leaving school, going from work back home to check on it, that's not normal, right? Again, all very treatable. Now, I've made an effort recently to reduce my collection. I used to have collections of so much stuff that I was afraid that I was going to be in that program called hoarders, right? So this is tied to our chapter. Why? Because if you've noticed that program, if you've ever seen that program, whenever they try to help the individual clean up or let go of some of their things, they immediately start to get stressed. And then one of the things I like about that program is they usually have a mental health professional working with that situation. Now, it's not always successful, but you can see how things kind of get out of hand. And that was my revelation recently. It's like, how many things do I really need? So I thought, help me with my collections. I thought I'd eliminate it to my most 100 precious things. Now, why 100? I don't know. It just seems like a nice round number. So it's been a fun exercise trying to identify the most precious things that I would take with me. If I packed up and moved to an island, these 100 things should come with me. The rest I love, but I don't really need. Maybe somebody else could use them. So I'm going to get rid of them soon. Obsessive compulsive related disorders, including body dysmorphic disorders, where people sometimes go to extreme measures to change something about their body, right? I saw a clip of a gentleman who really was convinced that he looked ugly. He felt like he looked like a monkey. And so he had all kinds of surgery done. And his mom was like, what's wrong with you? You're handsome, right? Why would you think you look so horrible? But he was absolutely convinced when he looked in the mirror that he just saw this horrible individual. He eventually, sadly, committed suicide. So he wasn't able to get the help that he needed, obviously. It can include things like pulling one's hair or picking one's skin. And it starts off very mildly, right? Very mildly, and it just becomes so severe. But again, these are all very treatable. There's something neurologically, psychologically out of whack. And our job is to get it in whack, sometimes through therapy, sometimes through medication and therapy. And it frees people up. You don't have to walk around with all this anxiety anymore. So, are you ready for the review questions? I thought you would be. Of course, you know that I'm going to ask you a question about the case study of Keep Your Eyes Peeled. Tell me everything you remember about this case study from the very first clip, as well as the stated diagnosis. And if I'm going to talk about Keep Your Eyes Peeled, you know I'm going to talk about Highway Freakout Story, the same thing, as detailed as possible, as well as the diagnosis. And the final question, we've got three in this one, is I want you to tell me everything you know about xenophobia and how it impacts society. This is a very timely question for our time. As usual, as you know, when it comes to my essay answers, more is better, right? In my life, I'm trying to reduce, but in this case, when you go to answer these questions, as well as all the questions on the exam, more is always better. Remember, pretend like I don't know the answers, and so you're going to explain it thoroughly. Looking forward to talking with you next time. Take care.